Thank you for inviting me to speak today. I have been a student learning with all of you this past several weeks, and I am honored to contribute to the telemedicine hack. I have no known financial disclosure or conflicts of interest with the material in this presentation. The goal of this presentation is to encourage all of you to try a telehealth telemedicine visit. As an occupational therapist and an allied medical professional, I will be using the term telehealth instead of telemedicine. I will be talking about how our small practice delivered services prior and during the COVID-19 public health emergency using telehealth. I will also be discussing how we OTs conduct our OT assessment via telehealth. And lastly, I'd like to share some life hacks or pearls that I have learned these last few months providing OT via telehealth. I am happy to talk about TherapyWorks PC. TherapyWorks is an outpatient pediatric therapy center in Lawrenceville, Georgia, right in the heart of Gwinnett County. This is the practice that I manage with my husband. Gwinnett County is northeast of Atlanta and is the second most populous county in Georgia. Gwinnett is also one of the most diverse suburban counties in the nation. Our team is composed of 15 OTs, PTs, and speech therapists. We serve close to 250 special needs families. We specialize in serving medically fragile children with multiple disabilities. We provide clinic-based one-on-one therapy, but we use a collaborative family-centered model. This is not a drop-off therapy center. Our clinic is open to parents, siblings, grandparents, extended family, etc. We had 0 telehealth visits prior to COVID. However, I personally have had experience providing school-based OT via telehealth, so I knew what it was all about. In May 2019, the Georgia State Legislation enacted Senate Bill 118, the Georgia Telehealth Act. This seeks to modernize the Georgia Telemedicine Act and renamed it the Georgia Telehealth Act to include allied medical professionals. It also provided for rate parity with in-person visits. However, OT was not included, so the Georgia Occupational Therapy Association, or GOTA, created the GOTA Telehealth Task Force to advocate for inclusion. With Georgia being a largely rural state, telehealth would mitigate geographic restrictions and allow for improved access to specialists like pediatric OTs. Boy, do I miss my problems in 2019. So fast forward to March 14, 2020, when Governor Kemp put Georgia on lockdown due to the COVID-19 pandemic. From a busy and growing practice, TherapyWorks had no choice but to close our doors. We then went to work and ramped up our advocacy efforts for reimbursement of OT services via telehealth so that we can continue to support families and provide medically necessary therapies. OT was finally granted inclusion due to the flexibilities provided during the public health emergency. At the same time, GOTA was educating OT practitioners in Georgia on telehealth. As a practice owner, I had to revise our workflow and create new policies and procedures while educating my therapists to transition their practice from in-person to telehealth. We had to quickly learn, then teach the technology, and to troubleshoot it in order to make successful visits. We also educated families on what telehealth is all about and how they can access it on their devices. Last but not the least, We research on best practice for OT via telehealth. At the beginning of the public health emergency, all our therapy visits were done via telehealth. At the moment, 75% of our visits are telehealth and 25% are in person as we are slowly trying to get back to the clinic. We are not yet at our capacity and are serving only 60% of our patients, as some decided to stop therapy altogether for the time being. But we are still here. We are open, albeit virtually. Our therapists are working, and we are continuing to serve our families. I have to have my little spiel about occupational therapy. Occupational therapy is the use of assessment and intervention to develop, recover, or maintain a person's meaningful activities or occupations. As OTs, we look mainly at activities of daily living. This is not just basic things such as a person's ability to eat, get himself dressed, groomed and bathed, go to the bathroom, but also take care of the home, do his job, and participate in leisure activities in the context of his environment. OT is focused on what we call skills for the job of living. Like me, a lot of occupational therapists work with kids. But kids don't have occupations. They don't have jobs, you say. And this is where I beg to disagree. A child's occupation is mainly to play, so he can learn about himself, his environment, and form relationships with the people around him. A child can also be a student whose job is to learn concepts which prepare him for future work. He is also a son or a daughter to his parents, a sibling to his brothers and sisters, and a friend to his peers. Our version of the physical exam is the occupational therapy assessment or evaluation. I like to think of assessments as snapshots of an individual's ability to function in his environment, doing activities that are meaningful and purposeful to him. We look at a person's strengths, endurance, his ability to access his own home and work environment, and the larger community. We look at how he can use his hands to manipulate objects such as buttoning a shirt, tying a shoelace, using a computer, or operating a machine. OTs also consider the context of where the individual is functioning and how he interacts with people around him. This snapshot helps us determine how the person is functioning in the context of his environment and if he needs remediation or intervention. We also determine if there is a need to modify the environment to accommodate for his disability, as well as look at compensatory skills that he can learn so that he can function and participate in the daily demands as independently as he can. We would typically do OT assessments in our pediatric therapy center. Parents would bring their child to an assessment session, and there we would review medical history, use clinical observations, interview the parents or the caregivers and the patient, and also use standardized tests to determine the level of disability and medical necessity to justify services. Sometimes a child would not want to participate in an unfamiliar environment, and so we will interview the parents and ask them to describe the home environment and how the child is functioning there. Telehealth has allowed for OTs like me to come into the home and not only take a snapshot, but through video, understand the environment that the child is moving in. It has allowed us to problem solve and collaborate with families on appropriate environmental modifications and accommodations to facilitate increased participation and independence. We have been able to involve family members such as aunts, grandparents, and siblings who typically would not be able to participate in therapy due to time or geographical constraints. With the parents' permission, we can use the recording capabilities of telehealth platforms to capture a child's level of function and use it as a baseline when we measure outcomes. I don't just have to write about how the child is doing in a written report. I can show you. Here are my top 3 life hacks for telehealth. My best training ground for providing telehealth was teaching my 73-year-old mom how to use FaceTime. You all know how that goes. To have a successful visit, you have to be able to teach patients how to set up and use the platform. You have to learn how to use describing and positional words like that red button in the middle with a picture of a phone. You have to feel comfortable with troubleshooting issues. A good visit will lead to another good visit. A bad one is probably the last. Know that there will be pushback from clinicians, providers, patients, referral sources, and third-party payers. Telehealth or telemedicine is still largely unknown and unfamiliar to the population. A lot of people still think it's an approach more than a location of service. However, a lot of us know that it can be a viable option for appropriate patients. I had to get buy-in from all of the above in order to be able to provide the service and get reimbursed for the service provided. I had to tell clinicians in our practice, try one session and see if it's a good fit. As much as telehealth may or may not be appropriate for all patients, know that it may also not be a good fit for all clinicians. But you will never know until you try. I have therapists who do not want to have anything to do with telehealth and those who only want to do telehealth. Lastly, COVID-19 is probably the biggest event in my lifetime that has brought about huge changes to our practice, our community, and our world. As John F. Kennedy once said, change is the law of life, and those who look to the past and present is certain to miss the future. As clinicians and as individuals, we have to look ahead and be prepared to adapt to our changing world in order to survive and thrive. Thank you very much. These are the references that I used for my presentation. And if you have any other questions, you can email me at eileen.deogracias@therapyworkspc.com. You can also connect with me via LinkedIn. Thank you.